Have you ever heard of a case of exposing oneself online for bribery? On April 9, 2021, Dr. Feng Hua from a hospital in Datong City, Shanxi Province exposed himself as receiving more than 500,000 renminbi kickbacks for medical practice and said he was willing to be thoroughly investigated. Usually, people who receive kickbacks and bribes would cover up as much as possible, hoping not to be discovered. But why Dr. Feng exposed the matter proactively by himself? Because this incident was really unusual and it has triggered heated debate among the public. Let's take a look at what Dr. Feng said.
我做医生10几年，在此期间呢，我参与收受医疗回扣，保守估计在50万以上。
Unlike in the US, hospitals in China have pharmacies. In which hospital a patient sees a doctor, the medicine is usually bought in that hospital. Generally, about 80% of medicine was sold by hospitals in China. Dr. Feng also said that he was not the only one who received kickbacks. He and his colleagues, the president and vice president of the hospital, the department head, and pharmacists were also involved. Feng said in the video that he would correct his ways and plead for a thorough investigation. He also said that if he had the opportunity to continue practicing medicine in the future, he would like to practice medicine ethically and refuse to take bribes or receive kickbacks. A Chinese media report said that Feng began to report his receipts of kickbacks to the disciplinary committee of his hospital in May 2018. The committee accepted the report but never gave the results, for which Feng was also retaliated by the hospital. After that, he began to post videos on online platforms to report on the kickbacks matter. In one video, he claimed to be a bad doctor and showed his physician qualification certification. He also showed a large number of handwritten notes recording the drugs he had prescribed and the amounts of kickbacks he received. In fact, in mainland China, it is a common phenomenon and an open secret that doctors get kickbacks for prescribing drugs. In 2019, Highland Special Zone Daily reported that a doctor from Heletang Hospital in Hainan Province broke the news that many doctors at the hospital, including himself, were receiving kickbacks from pharmaceutical companies, while the hospital leadership turned a blind eye to the situation and may have even been directly involved. He claimed that some doctors in the outpatient department have a large volume of business, such as you can get 15,000 renminbi of kickbacks if you prescribe 100,000 renminbi of drugs. That is, 10 to 15% of the drug's sales revenue would be paid back to the doctors. The doctor also provided the reporter with 5 sheets of kickbacks records. He pointed to one of them to reporters. The first column is the name of the drug, such as this pediatric Baotaikang-based drug. If the doctor prescribed a case of this drug to the patient, they will be able to get a kickback of 5 renminbi, which is represented in the second column as the number 5. And the number 2 in the third column represents the quantity. Last June, I prescribed 2 cases of this drug, and at the rate of 5 renminbi per box, I could get a payback of 10 renminbi, which is the number of 10 in the last column. The doctor said pharmacists of the hospital settle with pharmaceutical companies, then send the kickbacks to the doctors in cash, and the pharmacists get their rewards from the pharmaceutical companies as well. There are doctors who were sentenced for prescribing drugs to get kickbacks. On March 9, 2017, Beitai District Court in Shaoyang City, Hunan Province, gave the verdict that the Neurology Department of People's Hospital of Shandong County was found guilty for collecting a bribery of nearly 2.7 million renminbi, and was sentenced to a fine of 200,000 renminbi. The director of the department committed the crime of accepting bribes and was sentenced to 1 year and 2 months in prison and a fine of 100,000 renminbi. There are intrinsic reasons for the formation of the common practice of doctors getting kickbacks for prescribing drugs. The pharmaceutical industry is different from other sectors. Drugs are special commodities. Medicine and pharmaceutics are extremely specialized fields in which the average consumers, patients, know little to nothing. So there is a serious knowledge asymmetry in the process of purchasing and consumption of drugs. Patients have to completely rely on doctors, so almost all patients follow doctors' instructions. Whatever the doctor prescribes, the patient has to buy. So in the whole consumption chain, the decision maker is the doctor, and the patient as a consumer has no related knowledge to make decisions. It is the patient or the health insurance that pays for the medicine, so the doctor as the decision maker does not bear the responsibility and consequences of the cost of medicine. However, the direct consequence of this situation is the rapid increase in drug prices. In February 2019, four mainland media companies conducted a study on the prices of some commonly used drugs and released the statistics. From the table, we can see that drug prices generally have a significant increase of more than 50% within 1 year, with the largest increase of 900% in 1 year. Shili Chen, a Chinese pharmaceutical industry consultant and head of Beijing Ding Chen Pharmaceutical Consulting Center, said, "One of the main reasons for the quick increase in the price of finished drugs is the increase in the price of active pharmaceutical ingredients, briefly API, which is caused by monopoly. Not all companies can produce API." China's Drug Administration law stipulates that API used by drug manufacturers to produce finished drugs must have a drug approval number or a certificate of registration of imported drugs or pharmaceutical products issued by the State Council's Drug Supervision and Management Department. These restrictions made the approval very scarce, leading to a monopoly. Chinese economist Ren Zeping analyzed that the high price of drugs is also directly related to the high cost of sales of pharmaceutical companies. Take Shandong Buchang Pharmaceuticals Company as an example. In 2019, the company achieved a revenue of 14 billion RMB, but the sales expense was 8 billion RMB, accounting for 55% of revenue. Public information shows that in 2019, Shanghai Pharmaceuticals again became the top sales expense with a sales expense of 13 billion RMB. Fosun Pharma followed with a sales expense of 10 billion RMB. 70 other companies had a sales expense of more than 1 billion. Among the 321 listed pharmaceutical companies, nearly 40% of the company's sales expense exceeded 30% of total income. And more than 10% of the company's sales expense exceeded 50% of total income, of which Haibio Pharmaceuticals' sales expense ratio was as high as 96.48%. In 2018, Ren Zeping, then dean of Evergrande Group Economic Research Institute, wrote a report called Unveiling the Mystery of the Abnormally High Sales Expense of Chinese Pharmaceutical Companies. In the report, Ren mentioned that a survey in 2014 showed that in the sales process of Chinese drugs, there are 6 main groups of sales expenses for pharmaceutical companies. First, bidding agency bribing. Second, hospital leadership bribing. Third, kickbacks for doctors prescribing the drugs. Fourth, commission for sales staff of pharmaceutical companies and pharmaceutical representatives. Fifth, the cost of tax evasion and money laundering. Kickbacks and bribes are not invoiced, and sales have to buy other invoices to reimburse the related expenses. Sixth, the cost of counting the amount of drugs prescribed by doctors and the cost of prescribing documents. Among them, kickbacks for doctors accounts for about 51.5%. In 2018, the total number of sales employees of Chinese A-share listed pharmaceutical enterprises was 382,000, accounting for about 1/4 of the total workforce. It is clear that sales is crucial to pharmaceutical companies. When drug prices rise sharply, it is the average consumer and health insurance that are hurt, and the losses suffered by health insurance will eventually be passed on to the customer. At a time when the public is complaining about the high prices of drugs, an announcement by China's Ministry of Finance of administrative penalties against 19 pharmaceutical companies has generated even more buzz. On April 12th, the Ministry of Finance announced the announcement on the inspection of accounting information quality by the Ministry of Finance of the People's Republic of China. It imposed administrative penalties on 19 pharmaceutical companies in accordance with the accounting law of the People's Republic of China. Among the penalized pharmaceutical enterprises are a number of listed companies such as Shandong Buchang Pharma, Jiangsu Hengrui Medicine, Shanghai Pharmaceuticals, and 999 Group Corporation, etc. The announcement pointed out that some pharmaceutical enterprises have the following problems. First, the use of false invoices and bills to obtain funds for other use. Second, fictitious business matters or the use of pharmaceutical promotion companies to obtain funds. The announcement pointed out that Shandong Buchang Pharma paid funds to pharmaceutical promotion companies in the name of consulting fees and marketing fees, which were then transferred by the pharmaceutical promotion company to the company's agents, involving an amount of 51 million RMB. The Ministry of Finance imposed a fine of 50,000 RMB on Shandong Buchang Pharma. Sanju Medical and Pharmaceutical Corporation was fined 50,000 renminbi by the Ministry of Finance for inaccurate charging of video shooting project production fees in 2018, involving an amount of 13 million renminbi, and inaccurate charging of conference fees in 2018 for the company's headquarters and Guangdong area, involving an amount of 88 million renminbi. The announcement said the penalty deterred drug companies from jacking up drug prices and other violations. Apparently, the fine is nothing for the filthy rich drug companies, and it remains to be seen whether the deterrent effect can be achieved. On November 30th, 2020, the head of China's National Health Insurance Administration said that China has built the world's largest basic medical insurance network, stating that more than 1.3 billion Chinese people can afford to see a doctor and purchase medicine, and the medical insurance policy for poverty alleviation has benefited 480 million poor people to seek medical treatment, helping nearly 10 million households to escape poverty due to illness. But several Chinese urban residents told Radio Free Asia on December the 1st last year that expensive medical bills are like a mountain that weighs them down. Qi Zhirong, a disabled survivor of the 1989 Tiananmen Square massacre, suffers from kidney failure and needs to go to the hospital 3 times a week for dialysis. He told Radio Free Asia, "I can say with certainty that I can't afford to see a doctor like they say. I go to the hospital for dialysis 3 times a week. Even supported by medical insurance, I have to pay more than 2,000 renminbi a month out of my own pocket. I can't afford it with my pension because so many supplementary medicine needs to be paid out of pocket." I also saw a case of a 4-year-old girl who suffered from liver cancer. Her father and the girl jumped into the river suicide. They couldn't afford the expensive drugs. I feel saddened to my heart. On April 29th last year, a netizen tweeted a video. An 83-year-old mother carried liquefied gas cylinders to raise medical expenses for her 60-year-old son. Apparently, this old mother and her 60-year-old son are not among the alleviated from poverty population. In May of 2020, news of a girl in her 20s selling herself to save her father attracted people's attention. The girl said tearfully in the interview, "Dad suddenly had such a serious disease and will need to continue to be treated, but we cannot get a penny for it. Dad will have to have 2 stent surgeries later, and now he has to be on dialysis twice a week. And the situation may change at any time because his high blood pressure is not under control, and the cost of treatment is incalculable. The doctor told us to prepare at least 200,000 renminbi to save Dad's life, and the overall cost of stent surgery rehabilitation is estimated to be around 400,000 renminbi. My mom and I were very anxious, but there were nothing we could do, so I said, whoever can pay my dad's treatment cost, I am willing to marry him." Apparently, they are not on the list of the promised the world's largest primary health network either. On October 21st, 2020, a young mother jumped off the roof of Ningbo Women and Children Hospital with her 4-month-old baby in her arms. They died on the spot because she couldn't afford the child's high medical bills. The tense game of various interests in the pharmaceutical industry is bewildering, and the result is that it leads to soaring drug prices. However, there is only one outcome that patients hope for, and that is for commonly used drugs and drugs for serious diseases to actually be affordable and for medical care to be no longer so expensive. If the moral level of the whole society is raised to a very high level, everyone's sincerely considerate of others, and there is no greed for excessive pursuit of profit by the government, pharmaceutical companies, and doctors, the problem of high drug prices may be solved.